Hello everyone, welcome back to our channel. If you're new here, make sure to subscribe and hit the bell icon so you don't miss our weekly videos on behavioral research techniques. Today we're diving into a fascinating concept used extensively in behavioral studies, the multiple baseline design. Whether you're a student, a researcher, or just curious about psychological study methods, this video will break down everything you need to know about this powerful design. Let's get started. The multiple baseline design is a powerful research strategy often used in behavioral analysis to study the effects of interventions. Unlike designs that require withdrawing the intervention to observe effects, this design keeps the intervention ongoing and varies when it starts across different behaviors, settings, or subjects. Here's an easy-to-understand breakdown of its key components, variations, and guidelines. There are three basic concepts. Simultaneous baselines. Multiple behaviors are monitored at the same time, without any intervention to establish a baseline how these behaviors naturally occur without interference. Sequential intervention. The intervention starts with one of the behaviors, while the others continue to be observed without change. This staggered approach helps to clearly see if changes in behavior are due to the intervention. Staggered application. The intervention is applied to the next behavior only after significant improvements are observed in the previously treated behavior, thus preserving the integrity of the design by isolating the effect of the intervention. When do we use multi-baseline design? 1. When withdrawal of intervention is infeasible or unethical. If withdrawing an intervention might cause harm or discomfort to participants, or if it's unethical to remove a potentially beneficial treatment, multi-baseline design provides an alternative by allowing the intervention to remain in place while still assessing its effectiveness. 2. When long-term effects are to be studied. Multi-baseline design is suitable for observing how changes develop and stabilize over time, making it ideal for interventions expected to produce gradual improvements in behavior or skills. 3. With irreversible interventions. For interventions that inherently change the subject in a way that cannot be undone, example educational training, certain therapy techniques. Multi-baseline design allows researchers to observe the intervention's effectiveness without needing to reverse its effects. 4. In educational settings. Particularly useful in educational research, where different educational strategies or curricula are tested across different groups or settings without disruption to the ongoing educational process. 5. Behavioral interventions. Multi-baseline design is often used in behavior analysis to test the effectiveness of behavioral interventions across different behaviors, settings, or subjects, allowing for tailored interventions based on individual needs. Advantages of multi-baseline design. 1. Demonstrates causality without withdrawal. By introducing the independent variable at staggered intervals across different baselines and observing similar changes, multi-baseline design helps to demonstrate that the intervention, rather than other factors, is likely causing the observed changes. 2. Flexibility. Multi-baseline design can be adapted to various contexts and needs, including different behaviors, settings, or subjects, providing flexibility in how and where the intervention is applied and studied. 3. Ethical assurance. Since the intervention is not withdrawn, participants continue to benefit from potentially helpful treatments, addressing ethical concerns particularly relevant in clinical or educational settings. 4. Reduces confounding variables. By applying the intervention to different baselines at different times, multiple baseline helps to control for confounding variables that might otherwise influence the results, such as time-related changes or external events. 5. Individualized assessment. It allows for a more individualized approach, assessing how different subjects respond to the intervention, which can be particularly important in educational or clinical practices, where individual differences may impact effectiveness. 6. Avoids habituation and sensitization effects. Since the intervention isn't introduced simultaneously across all subjects or settings, the design helps avoid issues like habituation or sensitization that might skew results in a traditional group design. There are 3 types of multi-baseline design. Across behaviors. Different behaviors within the same individual are studied. Across settings. The same behavior is examined in different environments to check consistency. Across subjects. Similar behaviors are observed across different people, enhancing the generalizability of the findings. Variations of the design. Multiple probe design. This is used when it's not feasible to continuously gather baseline data. Short assessments or probes are used intermittently to reduce the burden and cost of constant monitoring. Delayed multiple baseline design. Starts measuring different behaviors at different times, especially useful when new behaviors or participants are added mid-study. Non-concurrent multiple baseline design. Unlike the standard approach, this design does not require all participant data to be collected at the same time, allowing flexibility but providing weaker evidence due to the lack of simultaneous comparison. Guidelines and assumptions. Functional independence. The behaviors studied should not influence each other, ensuring clear, independent assessment of the intervention's effects. Concurrent measurement. All behaviors should be measured under similar conditions to ensure fairness and consistency in data collection. Controlled introduction. The intervention is introduced systematically to subsequent behaviors, only after observing clear effects in previously treated ones, ensuring that changes can be attributed to the intervention. Variable baseline length. Baselines vary to ensure that the observed changes are indeed because of the intervention, and not merely fluctuations in behavior over time. Priority to stable baselines. Start with the most consistently observable behaviors to ensure reliable before and after comparison. Limitations. Timing of intervention. Delaying intervention for certain behaviors might be problematic, especially in critical situations. Insufficient baseline data. Too short baselines can lead to unreliable conclusions. Interactions among behaviors. Starting baselines at different times can sometimes lead to overlap and confusion about what caused the change. Let's practice some mock exams. Mock Exam 1. A researcher wants to evaluate the effectiveness of a new reading intervention program in 3 different classrooms, without disrupting the ongoing educational activities. Which multiple baseline design is most appropriate for this scenario? 1. Multiple baseline design across behaviors. 2. Multiple baseline design across settings. 3. Multiple baseline design across subjects. 4. Delayed multiple baseline design. Correct answer is 2. Multiple baseline design across settings. This design is most appropriate when studying the same behavior or intervention across different environments or contexts, such as different classrooms. It allows researchers to evaluate the consistency and effectiveness of an intervention across various settings without interference from other variables. 1 and 3, these focus on different behaviors or subjects rather than settings. 4, the delayed start is not necessary in this scenario since the focus is on different classrooms simultaneously. Mock exam 2. When is a multiple baseline design particularly useful? 1. When interventions are harmful. 2. When interventions cannot be ethically withdrawn. 3. When only one subject is available for study. 4. When the effect of the intervention is temporary. Correct answer is 2. When interventions cannot be ethically withdrawn. Multiple baseline design is especially valuable when it is unethical to remove an intervention that may be providing benefit, as it allows the intervention to continue while still assessing its effectiveness. 1 and 4, these situations do not specifically require a multiple baseline design. 3, the availability of only one subject suggests a single case design, but not necessarily a multiple baseline design. Mock exam 3. Which of the following is not an advantage of the multiple baseline design? 1. Allows for the ethical continuation of beneficial intervention. 2. Demonstrates causal relationships through staggered intervention application. 3. Suitable for studying reversible behaviors only. 4. Flexible application across different behaviors, settings, or subject. Correct answer is 3. Suitable for studying reversible behaviors only. This statement is incorrect as an advantage, because multiple baseline designs are actually advantageous for studying behaviors where reversal is not ethical or feasible. 1, 2, and 4, all these are true advantages, emphasizing ethical continuation, demonstration of causality, and flexibility. Mock exam 4. An occupational therapist wants to determine how different sensory integration therapies affect individual patients in different therapy centers. Which multiple baseline design is best suited for this study? 1. Multiple baseline design across behaviors. 2. Multiple baseline design across settings. 3. Multiple baseline design across subjects. 4. Multiple probe design. Correct answer is 2. Multiple baseline design across settings. This design is suitable for comparing how the same intervention works across different physical locations or environments, which is exactly what is needed when studying the effect of therapies in different therapy centers. 1 and 3, these focus on different behaviors or subjects, not settings. 4, multiple probe is not specified to be necessary here. Mock exam 5. Which design typically involves assessing the effects of interventions across different subjects, starting at staggered times? 1. Multiple baseline design across subjects. 2. Multiple probe design. 3. Delayed multiple baseline design. 4. Non-concurrent multiple baseline design. Correct answer is 4. Non-concurrent multiple baseline design. This design involves different subjects beginning the baseline intervention sequence at different times, which is suitable when simultaneous data collection isn't feasible. 1, 2, and 3, these involve either simultaneous baselines or specific procedural elements, not described in the non-concurrent design. Mock exam 6. A behavior analyst is studying the impact of behavioral interventions on three different problem behaviors: aggression, self-injury, and property destruction within the same client. Which multiple baseline design should the analyst use? 1. Multiple baseline design across behaviors. 2. Multiple baseline design across settings. 3. Multiple baseline design across subjects. 4. Delayed multiple baseline design. Correct answer 1. Multiple baseline design across behaviors. When studying multiple different behaviors within a single individual, this design allows the researcher to apply the intervention to different behaviors sequentially, observing the effect independently on each. 2 and 3 focus on settings or subjects rather than behaviors. 4. Delayed start is not relevant to focusing on different behaviors of a single client. Mock exam 7. Which design is characterized by intermittent measures taken before the intervention? Is introduced to assess stability and changes over time? 1. Multiple baseline design across subjects. 2. Multiple probe design. 3. Delayed multiple baseline design. 4. Non-concurrent multiple baseline design. Correct answer is 2. Multiple probe design. The multiple probe design is ideal when continuous measurement is impractical or costly. It involves taking intermittent baseline measurements probes before intervention, which allows for an assessment of stability and changes over time without the need for constant observation. 1 and 3, these designs typically require more continuous or staggered baseline measurements. 4. Non-concurrent design doesn't necessarily imply intermittent measurements. Mock exam 8. A study aims to compare the effectiveness of a speech therapy program among students in different schools. Which multiple baseline design is most appropriate? 1. Multiple baseline design across behaviors. 2. Multiple baseline design across settings. 3. Multiple baseline design across subjects. 4. Delayed multiple baseline design. Correct answer is 2. Multiple baseline design across settings. This design is chosen for evaluating the same intervention in different locations or contexts, different schools in this scenario, which allows for assessment of the intervention's effectiveness across various environmental conditions. 1 and 3, these options focus on behaviors or subjects, not the settings. 4. Delayed multiple baseline is not necessary since the interest is in different schools simultaneously. Mock exam 9. In which situation is a multiple baseline design not typically recommended? 1. When the behavior is expected to show quick reversibility. 2. When interventions cannot be withdrawn. 3. When dealing with irreversible interventions. 4. When long-term effects are to be studied. Correct answer is 1. When the behavior is expected to show quick reversibility. This option is actually a situation where multiple baseline might not be recommended because it relies on the stability and continuation of baseline conditions, which reversible behaviors might disrupt. 2, 3, and 4, these are situations where a multiple baseline design is recommended, especially when interventions cannot be ethically or practically withdrawn, and for long-term effects. Mock exam 10. Identify the design used when it is impractical to start all baselines simultaneously, and when baselines need to be introduced at different times for logistical reasons. 1. Multiple baseline design across subjects. 2. Multiple probe design. 3. Delayed multiple baseline design. 4. Non-concurrent multiple baseline design. Correct answer is 3. Delayed multiple baseline design. This design starts baselines for different behaviors or settings at staggered times, which is particularly useful when it's impractical to start all at once, or when new participants or behaviors become available during ongoing research. 1 and 2. These do not typically involve delayed starts of baselines. 4 non-concurrent designs involve different start times, but not necessarily staggered within the same study. Mock Exam 11. Researchers are evaluating the impact of a new behavioral therapy on students with ADHD in different classrooms of the same school. Which multiple baseline design would be most appropriate? 1. Multiple baseline design across behaviors. 2. Multiple baseline design across settings. 3. Multiple baseline design across subjects. 4. Non-concurrent multiple baseline design. Correct answer is 2. Multiple baseline design across settings. This scenario clearly involves examining the effects of an intervention in different classrooms within a school, making a multiple baseline across settings the most appropriate choice for observing how context influences the intervention's effectiveness. 1 focuses on behaviors rather than settings. 3 involves different subjects, which isn't specified in the scenario. 4 non-concurrent isn't suitable for a study wanting simultaneous comparison. Mock Exam 12. Which design is used when simultaneous baseline measures across participants are not possible, and instead, different participants begin the baseline intervention sequence at different times? 1. Multiple baseline design across subjects. 2. Multiple probe design. 3. Delayed multiple baseline design. 4. Non-concurrent multiple baseline design. Correct answer is 4. Non-concurrent multiple baseline design. This design is noted for its lack of simultaneous collection of baseline data across participants, which is typically used when different subjects start the study at different times. 1. Multi-baseline design across subjects requires simultaneous baselines. 2. Multiple probe design involves probes, not relevant here. 3. Delayed multiple baseline design involves staggered but simultaneous baselines, not separately timed ones. Thank you for tuning into our video today. We hope you now have a clearer understanding of multiple baseline designs and how they can be applied in various research settings. If you found this content helpful, please give us a thumbs up and consider subscribing to our channel for more insightful discussions. Don't forget to hit the bell icon so you never miss an update from us. If you have any questions or topics you'd like us to cover in future videos, please leave a comment below. We appreciate your support and engagement, and we look forward to bringing you more useful content. Until next time, keep exploring and stay curious.